So good morning, all participants. Also good afternoons as well in Thailand. So thank you very much for having me as a keynote speaker for the London International Conference on Teaching, Education, and Learning 2024. It's a great honor to attend these varieties of the conference regarding teaching, education, and learning to kind of, share experiences, exchange knowledge and also experiences, and also listen to the lesson learned that, all distinguished participants and also presenters um, are going to share. What I'm gonna talk to you today is, I think it's really important. It's not just because of like the emergent of the COVID-19 a couple of years ago, but also I think it's such a interesting topic, to be honest, as we are like the teachers, educators, or even you are like the students or any stakeholders concerning. What I'm going to talk is about the mental health and well-being of the teachers. What I plan to do basically, I would like to kind of, collect data consistently and systematically to understand and knows about the mental health and well-being of the educators around the globe. But it's such a big project, to be honest. So I just focus on, this topic just in Thailand only, where I'm living and teaching. So mental health and well-being of the teachers in Thailand. And my name is, as also Professor Dr. Patama Satawedin. I'm currently Director Master of Communication Arts in Digital Marketing Communications from Bangkok University, Bangkok, Thailand. If you would like to contact me, you can email me at patama.s@bu.ac.th. The things that I'm gonna cover today is like the overview, two main things, project objective, methods, findings, and also some final remarks. Shall we start with the overview? Why I'm interested in this topic, mental health and well-being of teachers and educators, is apart from being a teachers and educator, teaching in the higher educations at the university level. And I believe that not just only in Thailand, but also in other countries as well, that, find this topic interesting and, maybe face this kinds of the challenge as well. What I've find out, the first one is about the shortage in the health in the teachers' health, especially like the mental health. From Chit Suksai 2023, basically this quote or this statement from Chit Suksai is maybe focused on like the health and well-being of the children, but I think it's really important as well to be applied to explain about like the situations of the mental health and also the well-being of the educator in not only in Thailand, but also around the globe as well. Chisano Sai 2023 state that health and well-being are more than just a matter of physical health, but good mental health is to the foundations of a person's overall well-being, yet it is often overlooked. This is certainly true in Thailand, but the issue is growing concern. So this is like the first overview that I would like to give you about the shortage, especially in the teacher's health and well-being. The second one is like the limitations of the teacher well-being, especially, in terms of like the studies and also like the research. So Jude and colleagues 2022 suggest that there should be some more research and rich qualitative methods and also the tactics to be studied and examined. So this project objective, based on the talk that I got going to deliver to you today, is to investigate how mental health and well-being of teachers and educators in Thailand through preliminary literature review. So simply speaking, is understanding the mental health and well-being of the teachers in Thailand. What I collect the data is I collect from a database, online database from Bangkok University by searching and putting like the keywords, three keywords basically: mental health and well-being, teachers or educators, and also basically in Thailand. And then is that there are some more conditions that apart from search from Bangkok University database. So such keywords, three keywords: mental health and well-being, teachers or educators, and also Thailand, might be placed on a research title only. So my search did not just only limit to the peer review articles or any that there should be any forms of the papers or articles. So it comes up with the total article around 55K, but there were only like four papers or four articles that to be selected, and is calculated at like 0.007% only. So in this case, it's just search more from the Googles as well. But what I said is that it has to be remarked at this point that this is just only like a preliminary literature reviewed only. So there may be possibly there may be more articles or the researches about the mental health and well-being of teachers or educators in Thailand as well. But as I said, I mean, regarding to the studies of you and colleagues 2022, that said in the previous slide that there should be some more studies and also the researches regarding the educators' health, mental health and well-being as well, especially about regarding like the qualitative methods and also the tactics. So with these four, together with another two, the search from the Google, it comes up with these 6 insights. We'll start with different studies, which give you like the overall pictures of the mental health status and also well-being status of the teachers in Thailand. And from this study, Difference 2022 said that unfortunate prosperity during blended learning. Difference conduct this research to understand like the teachers' mental health and well-being when the teachers and educators are faced and challenged by the widespread of the COVID-19, and they have to use and apply like the blended learning and blended instructions. So different have used the words unfortunate prosperity. So I try to interpret these keywords, and the first one that I found is like unexpected numbers of the good mental health and well-being among the Thai teachers. And also, but that should be inclined to be this one, because in the details of the finding, Difference 2022 have found that the teachers in Thailand, they have not too much tense and also the depressed regarding to their teachings and instructions. But on the other hand, I interpret that unfortunate prosperity could mean to a greater rooms for improving mental health and well-being among the teachers in Thailand as well. So it means that they have got like, I mean, teachers and educators, they have got like, okay, neutral mental health and well-being status. So there should be some rooms or some kinds of the policies or the programs in order to help improve, encourage, the very more positive mental health and well-being among the teachers in Thailand. This is like an overall pictures. But there are some kinds of the variables and also factors encouraging kind of bad or good mental health and well-being status among the teachers in Thailand. Regarding to Ratana Siripong and colleagues 2021, they have found a variety of the factors encouraging or discouraging mental health and well-being of the teachers in Thailand, like for example, family economic status, relationship qualities, of even resilience, that is like the main predictors for the depressions, family economic status, classroom size, and restaurants also like the predictors, main predictor for anxiety. Family economic status, even gender, sleep, and also restaurants are all like the predictors as well for the stress. So it means that for the policymakers, administrators, or even like the other stakeholder concerning, they have to concerns about these kinds of factors in order to avoid Thai educators from depressions, anxieties, and also the stress. Ratanasi Ripong's and colleagues as well, correctly 2024, have done and conduct the research once again about like the Thai educators' mental health and well-being, and they have found several predictors as well that leading to depressions, anxiety, and also the stress, and also like the overall qualities of life. Like for example, years works at the teaching professions or even low sleep and self-esteem can lead to overall qualities of life. Even Gout and GN 2023 as well, focusing their studies on like whether or not physical activity, exercise, something that can lead to like the good mental health and well-being, which is very interesting. And it's found that it's like is really important. I mean, physical activity is really important predictor for the mental health and well-being, or even physical activity could lead to enhance like the teacher's efficacy or the self confidence, but not direct structural relationship. Physical activities can help encourage self-efficacy, and mental health and psychological well-being can lead to the self-efficacy. So we have to kind of encourage the teachers and also the educators in order to to attend some kinds of the physical activities, and also to have and strengthen the self-efficacy among the teachers in Thailand as well, in order to lead to the mental health and the good well-being. And also Whole to Health 2023 as well, that found that consistent growth in mental health and well-being studies in Thailand and also China, improving mental health and well-being of educators in China and Thailand. But there's some kinds of the limited and shortage because of like the insurance documents, or even like about money, human resource skills, and equipped with the proficiency, or even like having no clear knowledge about mental problems and deficiency. And last but not least is from Piyakun and Salim 2023, that work life could lead to the mental health and job burnout in Thailand and Indonesia as well. So the proposed solutions are like the final remark from Dalai Lama, that if you feel the burnout setting in, if you feel demoralized and exhausted, it's best for the sake of everyone to withdraw and restore yourself. So not just only take care of yourself, but also, stakeholder concerning, policy makers, administrators, or even, the teachers or the educators and the colleagues as well. And even like the peoples from the public health, taking care about like the mental health of people should take part in order to improve and also develop some kinds of the programs, thinking about how to improve or how to provide some kinds of the implementations in order to encourage or improve the teachers and educators' mental health and well-being. Don't forget that teachers and educators is one of the most important people in order to make the students, in order to build up, our future human resource. So that is all these are, the references that I have used for this talk. And then, well, thank you very much. Bye bye.